Welcome to Foxfire Focus, the podcast that brings clarity and insight to the industry's most relevant issues. Foxfire's mission is to provide the best service experience in eye care. So, we hope you enjoy what you're about to hear and that this information provides some perspective on the exciting opportunities facing our profession. For more information about Foxfire, please visit us at foxfiresg.com. Foxfire, taking care of your practice so you can manage your patients.
I'm Tim Nichols, your host, and my guest today is Korry Petterson. Korry is CEO of Foxfire Systems, a full suite of business services for optometry. Welcome, Korry.
Thanks, Dr. Nichols. Thanks for having me, and thanks for doing this.
Well, tell us about what Foxfire does.
Foxfire is a practice management and electronic health records company with we've been in business now for 49 years, and we have over 30 years of experience in practice management software and clearinghouse, and over 12 years experience exclusive in optometry.
Wow. How did you come to be exclusive just to optometry?
It's kind of a weird happening. I was very early for a meeting in a small town in Iowa, and I just across the street from the hospital I was going into, I saw this optometry office. Went in, had a conversation with the office manager, and the office manager said, "Well, it's very coincidental because we happen to be looking for a system." This was during when we had to get MPI numbers onto electronic claims, and they didn't have a system that could do it, and a lot of the systems that they were looking at couldn't do it either. And we were already doing it because we had to in the general medical space. So from there, we sat down with a focus group of several doctors and offices and developed a very robust optometry specific retail system with inventory, lab integrations, and everything. So we've developed quite a bit of experience in the optometry space.
There are a lot of unique things about the business of optometry. What challenges really are there for you in providing services for optometry practices?
Well, like I said, with the retail component and the medical component, it is two areas that optometry has to focus on that in outside of optometry you don't see. Retail businesses don't have medical care, and medical offices don't typically have a retail component, and they don't have the interfacing to labs and those types of things. So it is a major challenge for these offices to be able to run both sides, do proper data analytics, and be able to, in an independent environment when it's only a couple of doctors, be able to afford the staff to be able to do this and to manage everything. And it gets very overwhelming.
Now, you're in and out of a lot of practices and you talk to a lot of eye doctors. What do you see in successful practices that they do better than practices that aren't doing that well?
There's really three areas that I see that the successful offices are really focused on. One is data. They're really managing the practice based on data and metrics and making sure that what works, they continue to improve upon. What doesn't work, they move off to the side and go a different direction. They're always trying new things. Number two is the training. They're always training their staff. They're always investing in their staff because they want the staff to be able to explain things to the patients the way the doctor wants it explained. So the only way you're going to get that done is by training, role playing, making sure that the staff says exactly what you want them to say in the appropriate time and getting the information. And number three, the owners are very hands-on. They don't just turn it over to somebody else and expect that, hey, everything's going to be great. They make sure that everything is working the way it should, whether it's through data, whether it's through proper management, systems in place. There's always a system of, okay, if you have an angry patient, you do this. Yeah, if you have an appointment that needs to move, you do this. You have systems for everything.
Hmm. Interesting. The business landscape of optometry and eye care has changed a lot over the last few years. There's the entrance of private equity, certainly retail's a large component, internet sales. Where do you see optometry going as a business?
Three things that you mentioned are not going away, and they'll take their fair share of business. But it also leaves a tremendous opportunity for independent optometry. Big box retail is never going to be able to offer the service and the products that an independent optometrist can. Venture capital, once there is not local ownership in the practice, there's that love of the practice, the love of the community that is lost. And I'm not trying to be sappy by saying love, but that's really what it is. You put your blood, sweat, and tears into these practices. That's love. And you're not going to have that in a private equity. A lot of times people are just going to be cashing paychecks. And then online, you're going to have a certain amount of patients that go online, but everybody in independent eye care knows it's not going to fit. There's going to be problems. Who's going to uh, work on the frame to get it to fit correctly? Yeah, it's never going to be the answer. This is all three of those things are great for the independent optometrists that take care of their patients.
Hmm. Now, as your company kind of comes alongside the independent optometrist and brings a unique set of services, what are some of the things that your company does to really stand with the independent?
Uh, Over the last 12 years, we've worked very hard to work with other leaders in the industry to do things better for independent optometry. Work with different industry experts, different companies, and learn from them. There's a lot of really good, knowledgeable people out there that have helped us to develop things to keep the independent doctor working better, faster, using better technology than just the whole hung. One of the worst things that any owner of any business can do is, well, we've always done it that way. Well, everything evolves. So 40 years ago, I probably weren't using an OCT. So the industry is always evolving.
Yeah. Now, you have a users meeting every year. Tell us about that meeting.
At the users group meeting, we bring everybody together to talk about things that the system is we've improved in the system based on the customer's feedback, but that's only a portion of it. We bring in other industry leaders to talk about what works for other independent offices so that our doctors can do a better job. We have doctors who give presentations about what they've done that is successful. We really build a community of our users and bringing in other experts in the industry to educate and so that doctors can take home a lot of things to do. Also, from our users group meeting, we help. We actually take a list from every user that comes of what they want to implement from what we've talked about in the meeting, and we go back starting the very Monday after. Okay, let's tackle this, get this going, and it is very, very successful for these practices to kind of have an accountability partner.
Excellent. Well, Korry, thank you for your time and telling us about what your company does to help support independent optometry. Appreciate that.
Thank you very much for the opportunity. I appreciate it.
All right. So, Eyes on Eye Care, talking about the business of eye care. Tune in, please. We'll have more experts from this industry talking about what you can do to help your practice thrive. Thanks.